You can say hi to our YouTube family. And there you are live. Now we are, Doc.
All right, everybody, thank you for tuning in. It's Dr. Garrett Wiegriff here at Pure Plastic Surgery in Miami, Florida. Please check us out at pureplasticsurgery.com. You can get a bunch of this educational content we do every week. You can see before and after pictures. You can book a consultation. So again, that's pureplasticsurgery.com here in Miami, Florida. I am Dr. Garrett Wiegriff. I am a double board certified plastic and reconstructive surgeon. So on Thursdays, we talk about different topics within plastic surgery. Today, we're going to talk about kind of a sensitive topic, especially for surgeons out there, but we're going to be talking about revision surgery and kind of a few different iterations of revision surgery or refinement surgery when it's either a surgery that I did on one of my patients or it's someone coming from a different plastic surgeon who had a poor experience and wants improvement. And we'll kind of talk about some of the decision process that goes into that and some of the limitations with revision surgery. And we're also going to talk about something called maintenance surgery, which is not revision surgery and it's something that's expected with certain procedures. So let's start off just by saying what I consider a refinement surgery. You know, whenever a surgeon performs plastic surgery on you, they're always trying to get you the best possible result. And pretty much any one of our patients, even a great result, we can always find minor things to nitpick that we would like to see improved. And does that meet the threshold of requiring a touch-up of some kind? Sometimes it does, sometimes it doesn't. And oftentimes we need to look at all the things that went into the surgery and what your area of concern is and what we can do to control controllable factors like weight changes, weight gain, weight loss, and how that can affect your results of your plastic surgery. And then sometimes they're just little things that we can improve. Sometimes a dog ear or something, or a little lumping of skin, or an area where the scar didn't heal very nicely, or you had a little wound that formed, and then that formed a scar. So some of those things can be addressed with little refinements that we can do here right in the clinic under local anesthesia, with just injecting something, cutting something, reclosing it. And that's pretty minor and something that's really has a minimal cost. Then we have to get into the little larger refinement issues, things that can happen like capsular contractures, that kind of stuff. But that happens very early on. Sometimes we have to replace implants, do other things. And no matter what, there's known risk associated with any surgery. And so sometimes those things are just kind of part of the process. But we help you, in regards of the cost of those procedures to do that when it's a patient that I've operated on and you had an outcome that we, weren't expecting or something that needs to be improved. But there are some costs still associated with it for the cost of our facility and anesthesia, even though I may not be charging any fee related to that. So that's kind of one thing, separate issue. The next is I had a few patients this week that came to me from that had surgery with a different surgeon, actually a really prominent, well-known surgeon that does a lot of the types of procedures that she had done. She had what she feels is a very poor result, and she's not happy with it. And she came to me for my opinion and what I could offer. So whenever we're in this position, and again, like I said, a very popular surgeon who does a lot of the types of surgeries that she was looking at, we see these. The best of us can have suboptimal results, and then sometimes defining what a suboptimal result is a difficult thing, because what it may be to a patient may be different to the subjective eyes of a surgeon thinking that's actually a pretty good result, and you just have super high standards of what you're looking for. But whenever it's with a different surgeon, the first thing I recommend is talk to your surgeon. You went through the process of vetting someone, trusting them to take care of you. They did an operation, and most plastic surgeons want the best for their patients and they want to provide the best care. So I always recommend going back to your original surgeon, talking to them about your concerns and seeing what they recommend, because they know exactly what happened. They did the surgery, they know what they did, and they can offer you their best advice on how to proceed. With that being said, I understand sometimes patients just lose, bless you, Willie.
I'm so sorry, Doc.
may lose trust in a surgeon if they had a really poor outcome, or if they just didn't vibe with their bedside manner and post-operative care, and that can happen to the best of us. And in those situations, some of the really helpful information for us to move forward with a plan to help fix your area of concern is to get the operative reports from your surgeon that did the previous surgery. That way we have a much better idea of what actually went on during the surgery. We can help come up with a good plan to treat you. Now, my next point about revision surgery, especially when it's been done by a different surgeon, is this is not starting from the beginning point, where it's typically a little easier to maximize our results starting fresh as the first surgeon to do it. So just a word of caution when choosing your surgeon, make sure you pick someone that you have a good relationship with, you have good rapport with, and then someone that you've done your research. And the best price isn't always going to get you the best result. It doesn't necessarily mean that paying a huge fee is going to guarantee a stupendous result either, but sometimes you do get what you pay for. So think about that when you're making your decision about booking your surgery. And then understand, if you're coming to me to fix a different surgeon's problem, I'm going to give you my best opinion of what happened, why you were not happy with your result, and I'm going to give you the options of what I can do to help improve things. But understand that there's always going to be limitations of how much improvement we're going to be able to do depending on the option that you choose. And so I'm always going to give it my all to get you the best result. And I do a lot of revision surgeries. That's commonplace in plastic surgery, especially with like breast and stuff, because things continue to change, implants need to be replaced. So revision surgery is part of what we do. But you just need to come in with reasonable expectations and listen to our plan. We're gonna have a real frank conversation about what I think can be done and what can't be done. And get those operative reports from your prior surgeon so we can help make the best plan for you. Sometimes we need to do additional things like imaging, get CT scans or other things to better understand what your situation is. Then the final category of revision surgery is not really revision surgery at all. It's maintenance surgery. So who needs maintenance surgery? So anyone who gets an implant or a breast augmentation, at some point you're going to need a maintenance surgery. We're going to need to replace that implant or remove that implant at some point. They're not designed to be lifetime devices. Patients that have had massive weight loss, these are patients that are more than likely going to have a maintenance surgery at some point in the future, because after you've had those large fluctuations in weight, your skin just doesn't respond like a normal person's skin. It's lost a lot of its elasticity. So things like the breast tend to droop again with time. And that's no fault of the surgery, it's just what gravity does and how our body responds. And so those are considered maintenance surgeries and different than revision surgeries and something that should be expected, but your surgeon should explain to you when to expect that you might need a maintenance surgery in the future. So that's definitely something I always talk about when I'm doing implants or patients with massive weight loss. So I know that's kind of covering a large area of stuff, and it's a sensitive subject for patients and surgeons alike, because we all have, sometimes people aren't completely satisfied. My word from me is I'm always going to do everything I can to make sure you're satisfied, and we're going to work through everything we can and do anything that's realistic to get you to the point where you're totally satisfied with your procedure. And if you had a poor experience with someone else, please talk to them. But if you're still not happy with their answers, come talk to me and I'll tell you what we can do for you. All right, with that being said, do we got any questions from the audience?
Yes, we have a lot of questions and comments, but this is, can you please explain why the massages are so important after the drainless tummy tuck?
Yes, perfect.
Jaggy.
That was one of my questions I had written down that someone submitted earlier. So, I think lymphatic massages are helpful for any liposuction procedure, any tummy tuck, even a tummy tuck with drains. But why is it especially important for a drainless tummy tuck is because with the drainless tummy tuck, we're elevating all the skin and fat off of the muscles, repairing the muscles, putting all the skin and fat down, and putting extra layers of sutures to close down that space where fluid typically accumulates, but we're not able to 100% close down that space. So small amounts of fluid are going to accumulate. And what the lymphatic massage does is it helps get that fluid out from those little pockets that that are not completely closed, even though we put those extra layers of sutures, and it gets it to different parts of your body where the lymphatic system is still intact, and it can absorb that fluid. So that's why it's really important, especially for the drainless tummy tucks, to wear your garments and get your lymphatic massages so that we can squeeze out any little extra fluid that may be accumulating.
Okay, there's a patient on TikTok. Her pre-op it's tomorrow, and Doug, what for my nerves?
What for your nerves? So it is nerve-wracking sometimes to do your pre-op appointment. My word of advice would be write down your questions, because when you get in the room with your doctor, he's going to give you a lot of information. We're going to talk about a lot of things, and sometimes you forget your questions. So write down your questions that are really important to you, so you can be sure to go over all the things that you're worried about.
Okay, this is a male patient. He's having gynecomastia surgery and asks if this is something that will recur. Like will come back, like grow again.
That can recur? It's pretty uncommon for that to be a recurrent issue, but it is possible if they leave a little bit of the glandular breast tissue and you still have your underlying endocrine issue that caused it in the first place. But I would say that's a pretty rare issue to have a recurrence.
I did my procedure last August and I'm so happy with the results.
Oh, well, thank you so much. I really appreciate it. I hope you're doing well. Send us some update photos.
Well, everybody.
Everybody, yeah. Actually, that's something that I'm working on. So any of my previous patients out there, if you're comfortable sending updated photos, we'd love to share your results. And even if it's not full standardized pictures, if you're just in your clothes or in your bikini out enjoying life, send me your pictures. If you want to be featured, I would be happy to tag you and feature you, get you some more followers as well. But we're looking for some more of that content for our future patients so they can see your great results. All right, I think that was pretty much it. I have one more question written down. What happens after 6 months with the body sensation after a BBL? So a lot of people have like an itching or a tingling sensation that happens after getting liposuction in a BBL. That's related to the irritation from the nerves, and that tends to go away almost completely by the 6 month period, but sometimes it lasts a little bit beyond that, but it will go away and you'll return to normal.
Okay, I have a few more. Doug, pectus carinatum. Is that a word?
Yes.
Okay, I want to read the question because sometimes
Okay.
they write things that is just to mess with
Pectus
me.
carinatum is when someone has a skeletal deformity of their chest. Cavatum is when it's pointing in, and then excavatum is when it's pointing out.
Okay, the question is, I have pectus carinatum and I'm struggling to find a surgeon experienced with this and implants.
Yeah, so it can be a little bit of a challenge to do implants on a patient that has these skeletal deformities of their chest, because we can't change the underlying skeletal structure. So you just need to understand the limitations of what we're able to do. If you have carinatum where your chest is really sticking out, the implants are always going to stick out to the sides a little bit. And then if you have excavatum where it's pointing in, you can actually get really nice cleavage with that deformity because it's kind of sticking in. But you just need to understand the limitations of what we're actually able to do with the implants because of the underlying skeletal abnormality.
Where are you located?
Miami, Florida, pureplasticsurgery.com. Come check us out.
Okay, this is what's included in a mommy makeover and, well, how they can get a quote.
Okay, so most commonly a mommy makeover just is talking about two procedures that's combined at the same time. Typically a breast procedure, it can be a breast augmentation, a breast lift with augmentation. Typically some abdominal procedure, it can be liposuction or it can be an abdominoplasty. But it's a variation of those procedures. You can get a consultation at pureplasticsurgery.com, fill out the questionnaire, and we'll get you started on that process.
You're gonna love this message. Okay, I did reverse tummy tuck. My scar is beautiful.
Awesome, I love to hear it. So what is a reverse tummy tuck? This is a pretty selective type of tummy tuck we do for patients that has laxity only in the upper abdomen. And it requires us to make an incision underneath the breast that connects in the middle. We can lift that laxity up rather than the traditional tummy tuck where the scar is down low. All right, everybody, thank you for tuning in. I hope you all have a great day, weekend, and look forward to seeing you next week.
Thank you.